What's up, YouTube? Coming back to you with another video. I know it's been a minute, but I am going to stay as consistent as possible. This video today is going to be about my pregnancy and actually like the complications that I have had so far. Well, today I am currently 18 weeks and 6 days. I will be 19 weeks tomorrow. Um, in the beginning of my pregnancy, I did not have morning sickness until I was about 7 weeks. And the morning sickness lasted all the way up until my 12th, my 12th or 13th week, and then it went away. I had a subchronic hemorrhage as well. That's when you have like bleeding surrounding the baby or on. I can't. I can't even explain it right. But a subchronic hemorrhage is associated with bleeding, and sometimes women don't bleed when they have a subchronic hemorrhage. Unfortunately, I bled it out, and by the grace of God, it ended perfectly fine. I was grateful that I didn't have a miscarriage or anything because I was really, really, really concerned about that and very terrified because I never had that problem before with my other pregnancies. So, yeah, that is the subchronic hemorrhage actually started when I was about, I believe, 8 weeks, 7 or 8 weeks, and then it went away in my 11th week. So it lasted for a couple weeks. It started out like light spotting, and then it started to get heavy a little, then it started to get light, and then by the grace of God, it finally went away on its own. Whatever you do, ladies, do not put a tampon inside of your private area to stop the bleeding. You definitely not supposed to do that. Definitely put on a pad, and if you are very curious as to, anything bad happening, or if you never experienced it before, definitely don't be afraid. Never be afraid to step foot inside of the ER and let them know what's going on. No pregnant woman should be afraid to go to the hospital if she suspects something is wrong with either her or baby. And that is just how I feel personally. A lot of doctors are judgmental of the fact, like when you come in there for the smallest thing, they basically tell you something that you could have done yourself. But better safe than sorry. And it just kills me because a lot of these doctors try to act as if they really do care, and they really don't. But you know what? That's another subject for another day. I'm not even about to go there. No. I just personally feel a certain type of way, when I go to certain hospitals and I get judged for coming in there, because of the little things. I mean, little things can easily turn into a huge deal. And this is the life of you, and not only just you, your child that you're concerned about. So, ladies, never be afraid to step foot inside of the ER, call the ER, or call your doctor. It's a lot of things that we don't know as mothers, whether you're a first time mother, whether you're a fifth time mother. It's okay to ask questions. You have to ask questions because if you don't ask, you don't know. And also, I would prefer to do a lot of research. And another thing I recommend is if you do go to the hospital and you don't feel as if you had the proper treatment, never be afraid to have a second opinion, going to another hospital and getting better treatment. Because, like I said, most of these doctors aren't sincere in helping, pregnant women. They just brush you off like you're nothing, or the baby doesn't matter or something. Yeah, but anyway, not trying to go into a whole nother subject, just letting you guys know, don't be afraid to ask questions, or if you feel if something is wrong with your body, or in regards to the baby, please, please, please go to the hospital, because you never know. You never know. The littlest, smallest thing can turn into a big issue, regardless of what anybody else says. But anyway, yeah, so I had some chronic hemorrhage. It resided on its own, thankfully. I'm not gonna say that it's something that you should not be concerned about if it does happen to you. Definitely be concerned, because I definitely was, and you know, it never happened to me before, like I said, so it was very alarming, especially any bleeding during pregnancy out of your vaginal area is very alarming, especially because you hear those words all the time when they tell you, like, anytime you bleed from the vaginal area during pregnancy, please come into the hospital, but when I did go, they basically made it seem as if it was so normal. And I get that it might be to them, but to me it wasn't. Anyway, moving on. Yes, I am currently 18 weeks and 6 days. The last video I updated was about 2 months ago. I was 8 weeks and 5 days at the time. I recorded a video of the gender maker test, or whatever you want to call it, that I ordered off I ordered off for eBay, and it's supposed to predict the gender, but never get your hopes up about stuff like that. I just did it for fun, or just to see if it does work. To me, it'll probably be just a coincidence, or whatever. Maybe it really does work. But my anatomy scan is next Tuesday, and I am definitely going to do a video about the update of my anatomy scan. I'm going to definitely be finding out the gender of baby next week as well. But other complications in this pregnancy that I am having is placenta previa. I just found that I am diagnosed with placenta previa about 2 days ago when I got into a car accident. Thank God I wasn't extremely hurt, but I did have some after effects of the accident. There was a complete butthole on the road who tried to cut me off, not giving a damn. I could have had my kids in the car. Thankfully, they wasn't with me, but I did have an unborn baby in my belly. These people out here just don't care. I could have been handicapped for all he knew. But people are so in a rush to get where they need to be, or to prove a point, that's what they want to do. They're going to cut you off while you trying to make a turn and you have a right of way. I was in the left lane making a left turn. This guy was in the middle lane, and he decided, I guess I was moving too slow, so he decided to try to make a left turn in front of me. Instead, the dumbass ended up slamming into my passenger side door. But the impact was very, 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 I'm not going to say very, 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 but it was very hard, and it jerked me. Like, I definitely had my seatbelt on, but it jerked me really hard. My chest hit the steering wheel. Um, it felt like I was on, how bumper cars feel when you're on bumper cars or something like that. That's the feeling of the impact, but it was really hard. And so I know for a fact it definitely, if it jerked me, it jerked the baby. And I was rushed to the emergency room. My blood pressure was a little high. I was shooken up. Um, I didn't have any passengers in the car with me at all. I was by myself. Thank God my car is still drivable. It does have a lot of damage to it, but I'm just glad that not only just the car, but me and my child are still here, because it could have been worse. People are just assholes, and people just don't care about the life of anybody else just because they need to get where they need to be. And this is when I found out that I had placenta previa. They actually performed ultrasound. They performed 2 ultrasounds. The first one was just to find the heart tone, which they did. The second ultrasound was done by a technician who found out that my placenta is covering my cervix. I did not understand, you know what I'm saying? I heard about placenta previa like years ago, but I never really looked too heavy into it, because I was like, I felt as if it would never happen to me. Well, they do say never. You can't never think you can't ever think that something won't happen to you, because it will. It's a possibility. The things that you think won't happen to you will happen to you. And this just happens to be one of the ones, and it's not I want to say that it's kind of rare, if I'm not mistaken. But for those of you that don't know what placenta previa is, I'm going to, try my best to break it down to you. Placenta previa is a condition in which the placenta has grown low in the womb. This is a condition in which the organ which connects the fetus to the mother's uterus is low in the opening in the uterus. It can partially or completely cover the cervix. The cause of this is unknown, and it is more common with multiple births or twins. So what the doctor had told me was basically during conception, I guess like the placenta decided that instead of attaching itself to the wall of the uterus, it attached itself to my cervix, which obviously is in the wrong spot. It's not supposed to be there, and it is very life-threatening for not only me but also the baby, because once the bleeding starts, it's a possibility that it can become detached. Well, I'm sorry, I didn't say that. I didn't word that right. It's a possibility that it can become detached, and then it could cause the bleeding. It's kind of difficult for me to explain it But this is something that I didn't do, you know. It just so happened to happen, you know. And I was wondering, like, did the car accident cause it? And he said, no, the car accident didn't cause it. Um, the thing is, your placenta is growing, and now it's big enough for us to see the placenta on the ultrasound screen. So that's why all those appointments that I had in the past, and all the times I went to the ER, had ultrasounds, or when I had my 12-week scan, they missed the fact that I had the previa because it was so small and it wasn't that visible. But now that I'm getting further along, it's more visible to the eye. The main symptoms or signs of placenta previa is vaginal bleeding. The bleeding can be from mild to very heavy, and this condition can be very serious for not only the mother but the baby as well. Often there are no symptoms with placenta previa. Sometimes if the location of the placenta is very low, it will become partially detached and cause bleeding, like I was saying. And this may be simply a marginal sinus separation of the placenta. This is a separation of the vessels from the wall of the uterus, and this may cause no further problems other than mild anxiety. This is an increased risk of intrauterine growth restriction with placenta previa because of the abnormal placement of the placenta. Diagnosis is usually made by ultrasound exam of the uterus. There may be a careful vaginal exam to see the cervix. The patient will be prepared for a cesarean section immediately if necessary. Now, I'm going to tell you a few things as well. I don't want to have a C-section. I'm not bashing anybody for having a C-section or having to have a C-section, but I'm so used to vaginal deliveries and the attachment to my baby after a vaginal delivery that I don't want to have to experience a C-section. I don't want to be cut open, you know? Like, I just don't want that. And I just pray to God that I get the opportunity to carry my baby full term and deliver vaginally. They told me that I would. Okay, so I am having my anatomy scan next Tuesday. That is when they go over detail about the baby and the growth of the baby, and also the gender. And yes, I will be telling you guys the gender once I find out. But after my anatomy scan, they are going to do follow-up ultrasounds with me, I believe every 2 to 3 weeks. If I'm not mistaken, this is what they told me, to make sure that my placenta is starting to, like basically the further along I get, they want to make sure that the placenta is moved away from the cervix. Because if I happen to get to about 30 to 32 weeks and my placenta is still laying low over the cervix, covering the cervix, then I will not be able to have a vaginal delivery. I will have to have an emergency cesarean section. And also, the further along that I get in my pregnancy, and God forbid, but if they happen to see at my 32-week scan that my placenta is still laying across the cervix, it can also cause problems. It can, because now I'm getting bigger and bigger. So it's more risky. So basically, there's a possibility that I might end up having to have my baby very early. possibly before 36 weeks. And I can be on, they already put me on bed rest, by the way, so I am on bed rest at this point. I cannot lift anything. I cannot have anything put inside of the vagina. I can't even have vaginal exams. I can't have any sex. They told me to hold off on sex until I'm about 32 weeks. Can't tell you how hard that's going to be. But you know what? It is definitely for the sake of the baby, because the doctor told me that, you know, if anything happens during intercourse or me putting anything, rather it's adult toys, if you know what I mean, having sex or using a tampon, you know, I can accidentally hit the cervix. And once I hit the cervix doing that, then it's a done deal, you know. That's when the blood will come, and it'll be definitely difficult to stop it. So, yeah, I cannot have anything inside of the vagina until my placenta moves away from the cervix. So hopefully, the further along that I get, the placenta begins to move away from the cervix. They said they want to see if it can move at least 2 centimeters away. Because if it doesn't and it just stays like that, like I said, I will have to have emergency C-section. So yeah, it says the treatment for placenta previa is usually bed rest in the hospital or at home, and you may be given medication to stop contractions. Contractions can increase bleeding. Your doctor may take fluid from the baby's sac to see if the baby's lungs are mature enough for a C-section. A blood transfusion may be necessary if you have a low blood count. No further treatment may be needed when placenta previa is present in small degrees. Early placenta previa may resolve on its own. The placenta moves higher in the birth canal as pregnancy progresses. In this case, the placenta no longer is an obstruction to birth. The position of the placenta may need to be reconfirmed during pregnancy. This can be done with an ultrasound exam of the belly. It also states call your caregiver immediately if blood loss is very severe. Immediate fluid or blood replacement may be necessary. And with complete placenta previa, the only way to safely deliver the baby is by cesarean C-section. It says no bending or lifting. Take any iron pills or other medication your doctor gives you. Follow your caregiver's advice about bed rest. Do not have sexual intercourse. Do not put anything in your vagina, rather it's tampons, vaginal creams. If you are bleeding, use sanitary pads. Keep your doctor's appointments scheduled. And not keeping an appointment could result in a chronic or permanent injury, pain, disability, and injury or death to you or your unborn baby. Also, another thing, seek immediate care if you have increased bleeding, if you have fainting episodes or feel lightheaded, if you develop abdominal pain, or if you can no longer feel normal fetal or baby movements, if you develop uterine contractions. Of course, definitely go and seek immediate care if you just feel as if something isn't right, because this is your body and no one can tell you what's right or wrong. You know your body. I don't care if it's a doctor or a nurse. Nobody can tell you what's wrong with your body that you know all your life. So yeah, that's basically the complications. I've been having morning sickness had went away. I think I told y'all it went away when I was about 12 or 13 weeks. But I had the worst morning sickness as well with this pregnancy. Um, yeah, that's about pretty much it. I'll definitely keep you guys updated with things. And before I go, I will do like a little belly shot or whatever. Um, like I was saying, next week I have my appointment for my anatomy scan. I will keep you guys updated on that, and I will reveal the gender. Um, I'm starting to get girl vibes, to be honest, at this point. Um, I already have 2 girls, and I do have 1 boy, but I'm really hoping for a boy, or whatever God gives me, whether it's a boy or girl, I'll be thankful, you know. But everybody thinks that this is a boy. I did think in the beginning that it was a boy, but I keep having girl vibes. So I don't know. We are going to see, and I can't wait. I can't wait because I'm ready to start some shopping. But I'm gonna give y'all a little belly shot. This is my 18-week and 6-day belly. 18 weeks, 6 days. I do have like a few stretch marks. I don't know if y'all can see it because I'm pretty light. But yes, I do have stretch marks. My belly has not been that itchy at all though with this one. But we'll see the farther along I get, the more itchier it gets. But yes, I'll keep you guys updated as much as possible. I'll see you guys next week.